Kuhusiana na usambazaji wa maji hasa katika jiji kuu la Nairobi. Taarifa hiyo tunazidi kufuatilia kwa kina zaidi, lakini tutakujuza mwendo wa baadaye kwa mapana na marefu. Kwa sasa mtazamaji, tutaelekea hapa jijini Nairobi ambapo tume ya ufisadi na tume ya maadili na kukabili ufisadi EACC inazindua ripoti ya uchunguzi wa mfumo wa utendakazi katika bima ya NHIF unaosababisha ufisadi katika bima hiyo. Hebu tufuke moja kwa moja tusikilize ni kipi ambacho kinaendelea hapa jijini Nairobi.
For the first time in our health system, we are going to use digitization. There's no health facility that will provide service without a digital system. We are going to develop the hospital information system that is not going just to be on the private sector, the way we have been used to. Also the public sector, the public hospitals are also going to be digitized. Up to the remote facilities that we are seeing, within our counties, every part of our country is going to have a digital system. We are going to ensure that if you are registered as a patient, you are going to be treated in any facility without challenge. Before, we were restricting you to a particular area, a particular facilities that you have picked, but now we are saying with digitization, you should be able to receive a treatment across all the facilities. We have also ensured that we reduce congestion, which has been mentioned here, that we have challenges where people skip facilities. They move from a level 2 straight to level 5 or level 6. And that causes congestion within our hospitals. And that brings a challenge of corruption because you want to seek favors, you want to, to get treated, and therefore you indulge yourself in corruption. This time we are saying, we must follow the system. Let's allow the system to work. The referral system that you are talking about, we are going to ensure that as a ministry, we enforce it. We already have the policy in place. Now we have the regulations to support us in that. So I want to take this opportunity to thank EACC for this partnership. And I am saying that it will go a long way in fostering the reforms and entrenching accountability in the social health authority. Thank you.
Thank you, PS, for that statement. At this point, I want to invite the chairperson of EACC to also make his statements. Members of the press will be given an opportunity to seek clarifications afterwards. So, Chairman EACC,
thank you. Thank you. Let me just. That okay? Thank you very much, Bana PS and fellow colleagues who are here for this presentation. As some of you may know, under the Ethics and Corruption Commission Act 2011, EACC is given the mandate, a preventive mandate, to oversee the various government entities and give advice on its own initiative on any issues that would lead to corruption or prevention of the same. Prevention for us is a major area that we want to focus on because it is more preventive. Even in the medical sector, they say prevention is better than cure. And so we want to put our efforts in the area of prevention. And so we undertake these kinds of reviews so that we can help the various entities on how they can streamline their processes and their systems in this prevention effort. So corruption prevention is a proactive measure that we undertake, and therefore we remain committed to strengthening various systems and structures within government entities in line with the envisioned government's bottom-up agenda for economic transformation. There remains a critical need for public officials to personally mainstream values and principles such as good governance, integrity, transparency, and accountability as given to us in Article number 10. In particular, the Social Health Authority that is coming into force and is going to be leading a very critical sector of our society that ensures that our people are helped in their health care and they are financed when such a need arises. We believe that entrenching values and integrity in this area is going to be absolutely critical. And we want to call upon all those people who are engaged in this process to do so. We were actually invited, and this was not of our own initiative, and we really appreciate the NHIF for inviting us to just look at the systems, the operations of the NHIF, of the fund, and find out if there are any loopholes that are there that needs to be sealed so that the loss of resources is reduced, if not eliminated. And so we undertook this process for a period about 2 months, very comprehensive, looking at the systems, the operations, and how the various stakeholders interact with one another. And out of that, we have given this to the new board of the SHA, and we are also given a report to the NHIF so that they just know where they were at, because they're the ones who invited us, and our chair is here. Some of the key findings of the systems review include weak framework for corruption prevention in the fund. We found that the systems were such that they lent themselves to people who are corrupt to take advantage of the system. There were system gaps in the benefits package design. There were weak internal controls in the claims management processes. There are weaknesses in the ICT business environment, including ICT incident management, user access management, system gaps in the funding core enterprise system. There were delays in the healthcare providers contracting process, and weak framework for quality assurance and surveillance by the fund. And all these lent themselves to those people who want to take advantage to do so. Some of the key recommendations, therefore, that we have made for better service delivery for the new authority that is coming into place is to ensure optimal utilization of existing help desk platforms, to manage reported incidents of system outages and system disruptions, to avoid any kinds of bribery or extortion arising from the same, to enable conclusive resolution of issues and continual improvement of systems, to develop and implement guidelines for ICT user access management, with emphasis on management of third-party access to the system, aligning user access with the respective staff operational responsibilities, because these are some of the areas we identified and found weaknesses. To enhance efficiency for healthcare providers by defining and enforcing timelines for contracting healthcare providers, streamlining recontracting process, and using electronic contracting system, and enforcing contracting obligations. As a commission, we want to reaffirm our commitment to enhancing stakeholder collaboration with the various agencies and public officials in the health sector to prevent corruption, to promote ethics, integrity, and good governance. The examination report that we present today seeks to seal the identified corruption systemic gaps, loopholes, and weak internal control systems. As we said, this was done during the NHIF, but we find that the same, if not addressed, could easily be carried over into the new authority. And so we have made recommendations in the report that are aimed at quality assurance and strengthening of integrity, transparency, and accountability systems within the authority that has come into place. We also wish to enlist the support of the board the management, and the staff of the Social Health Authority to critically consider the findings of the report and within 30 days, develop an implementation plan for continuous monitoring by the Commission in order to effectively adopt an anti-corruption and bribery strategy that will ensure that people don't take advantage of this transition period to enrich themselves or to put in place loopholes that they can again take advantage of once the system goes live. Promote integrity and good governance in the operation of Social Health Authority and ensure efficient access and provision of quality healthcare services to all Kenyans. I want to thank you. The detailed report will be available actually to the general public, which you can look at and just pick out some of the things. But at this point, I want to hand it over to our MC.
Thank you, Chairman EACC, Dr. David Williams. From members of the board, at this point, we will give you an opportunity to seek any clarifications you may have from either the PS, from the chair EACC, or even from the chair Shah, who is seated here, Dr. Timothy, or even the chair NHIF, Michael. So when you're putting up to raise your question, I just want you to introduce yourself. You pick the media house you are representing and tell us who you are directing your question. I will start from the farthest. Secretariat, help the chair with the documents.
We have the.
Yes, my friend, start.
Thank you. Thank you very much. My name is Brian Bushiri of NTV, and my question is directly directed to Bishop Oginde and EACC, but also with reference to NHIF. The current board at NHIF is winding up its powers, but we have a case in court that has been presented by someone within HR by the name Hadija that seems to be still not in limbo or has not been addressed in the past couple of weeks. And now that NHIF is going out, about 45 million shillings has gone to these 11 individuals. Do we have any position on this? You have seated at EACC now for a period, and this matter has been presented to you on several occasions and even stamped, and the letter has been received at EACC. Perhaps your sentiments on this.
Thank you for that first question. I'm taking the second question from here. Would you please proceed?
My name is Manish Sode. I work with the Standard Picture News. I have 4 questions. The first one is the PS just said no health service will be provided without digital without a digital system up to the remote areas. Now, my question is, how much are we talking about when it comes to investing in that system? And then the issues of installation. Do we have a budget for that? Then second question is the PS. The malpractices reported by the EACC from the NHIF. We all understand that there is a transition right now. What is it that the PS is going to do when it comes now to the transition? Are we going to transit the people who have been found to be culprits or suspects in the previous NHIF system to the new system that is SHA? Are we going to transfer road from the other side to the newly formed outfit? And then to EACC, corruption has been reported in the institution severally, with the institution being ranked close to second every time you release a report. My question is, how far are we with those reports?